All right, it is 9 o'clock on the dot, so I am going to go ahead and get started. I am Paris Gray. I'm working hard to be your favorite Paris. And just a little bit of background on why I created the Medicare 2026 mindset group. It's because when I first decided to start enrolling individuals into Medicare, I have a background in insurance. I've been in insurance pretty much my entire adult life. So as soon as I decided to switch over to Medicare, I said, okay, let me learn the material, make me a plan, get a process, and I am going to be the best Medicare broker I can be for everybody. Okay. I had a perfect plan, got my license, I was ready to go. So let me tell you how that worked out. First of all, all you hear about Medicare when you hear about Medicare, and you let me know, you type in the comments what comes to mind when you think about Medicare. But when I was hearing about Medicare, all everyone wanted to say was, it's so confusing. It's so confusing, right? So hold on, let me make sure. Okay, we have it set up properly. So all I would hear was it was confusing. So when I first decided to start doing Medicare, my first open enrollment was last year. I decided that, hey, I'm going to make sure that it is not confusing because I'm here to change the mindset. And that is my goal for all of 2026, to change the mindset with Medicare and change the narrative that it's not confusing. It's just a lot of information to cover. And with that being said, that's why I want to talk about Medicare every way that I can think of. And you let me know if you have additional questions, because one thing for sure with Medicare, I don't want to call it confusing, but again, it's a lot of information to cover. And you only turn 65 once. You only have your first enrollment once. So that's pretty much saying that you're not an expert. So that's why you and everyone you know should use a broker, so that you have someone who is in the Medicare streets every day giving you the best information and being an advocate for you. Another group that's really tough, so I'm excited to be talking about the newbie Medicare folks, those who are 65, because anybody who is 75 or older, and especially if they never used an agent to enroll in their plan, they definitely don't have too much time or patience to let you explain things. And if you haven't noticed on the news, things are changing more and more every day. So that's my little intro. Let's get straight into turning 65, Medicare made simple for active parents, grandparents. And I wanted to start and kick off my Medicare presentation with active grandparents, because if you look around at folks turning 65, I'm 40 myself. My dad is 65. A lot of my friends' parents are getting close to that age, and definitely all of our grandparents are on Medicare. But let me tell you, the individuals that I meet that are just turning 65, they are not your typical, whatever you put in your picture or whatever society tries to say about seniors. That is not what is happening with our 65-year-olds. They are young. A lot of times they are still working. They are definitely active grandparents. And one thing I want to make clear when we're talking about building the foundation and first starting with Medicare is, it's a lot of information, and every little thing can be different for each person that's enrolled in Medicare. So, this will be a high level overview, but what's important to do is to meet with me one on one, meet with a trusted agent, if not me, and make sure that you get the perfect setup for your first time enrolling into Medicare. All right, so that's enough of this screen. Let's get right into it. So, oh, wrong one. 1 second. Okay. So, here, while we're talking about our active grandparents, this is something that I want to think about, because when we're first enrolling in Medicare, this is a perfect opportunity to begin with the end in mind. So, we're going to make our first Medicare decisions as though we are planning to live until the age of 100. So, if you are getting ready to turn 65 soon, definitely let me know in the comments. But do you have grandkids? Do you plan to travel? Do you want to volunteer? Are you planning to be a part-time worker? And I want to hear if you have like stories or experiences from those that you know that have been on Medicare before you. But let's take a moment right now. If you are watching this live, or if you are watching this after it's recorded, take a moment right now and just think about how you want to spend age 65 to age 100, or however age. Once we turn 65, we hope you are on average to have around 30 more years to go. So think about what you want that to look like, whether it's including work or not. So that is your first question that I want you to take away and answer and think about while we're turning 65. Yes, we're still talking about health insurance, but think about how active you want to be after retirement. So, just to go over the foundation so we make sure we're all here, Medicare was started in 1965 by President Johnson. Um, it is a federal health insurance program. It's primarily for those 65 and older. Sometimes you will see younger individuals on Medicare, and that is due to people with disabilities. Trying to wake up and get my words together. It is funded through payroll, taxes, premiums, and federal budget. So, this group, if you are turning 65 in 2025, 2026, don't let the commercials scare you about the fund running out of money and all of that good stuff. You can check in your SSA Gov that you've worked hard, and you can see that you and your peers have funded this program through your payroll taxes. So you're good to go. So that is the basis of what Medicare is. And one thing's for sure, changes will always come, but you can count on you turning 65 in 2026 and having your Medicare. So the next thing, I want to keep asking you questions as we go through this presentation because I really want you to think about how you would build out your Medicare plan for yourself. These are important questions that I'll follow back up with once we get ready to enroll in an actual plan because it will matter. It will matter if you want to be able to use your health insurance in and out of state. It will matter how long you plan to be in and out of state. So keep this question in mind. Write this one down and think about if you want to travel a lot after you enroll in Medicare. And remember, even if you're not turning 65 next year, if you're 60, if you're 55, this is still perfect time to start answering these questions for yourself because I'm positive that there's something that we can get started on as far as a product that you would want to pay for now before you turn 65 to set yourself up for success in retirement. So let's jump over and talk about the four parts of Medicare. There are four parts. Really, traditional Medicare, which we'll talk about in a minute, is part A and B. But let's give a high level overview because this is what you will see. And I want you to think about this like you're building a house. So, part A, let's start with part A. Let's build our hospital house. That is the hospital inpatient hospice, all of that. That is part A. So that is the base of our house. Part A, if you create you a SSA.gov account right now and confirm that you've worked 40 quarters, you would get part A for free. Now, there are certain circumstances that makes that be different, but for most individuals, if you've worked at least 10 years, Part A would be free for you. So we've got our house built for our Part A, and next we'll move into Part B. And we'll get into how much things will cost because I know you've heard about the Part B premium, but right now, let's focus on just building our Medicare house and understanding what makes up Medicare. So Part B is how that works with part A is we got our hospital and then part B is our doctors and our outpatient care. So now we've got part A, we've got our hospital built. Part B, we have our doctors that comes with a premium. You know, you got to pay the doctors to work. Part C, we won't go into deep detail with that right now because I call that the combo plan. That's Medicare Advantage. It's not truly a part of Medicare, but they call themselves Part C because it is a combo and combines some things. But keep that in mind. We'll talk about that in a minute when we talk about how we coordinate and make our Medicare work best for us. In Part D, those are our drugs, our prescription coverage. And why that's able to fit kind of after C is because depending on how you want to coordinate A and B to work together, Part D will change based on that. So, another thing I want you to think about when you're building this. So, you're probably saying, Paris started and said that this was not confusing, and it's not. You are now a business owner. Previously, when you had insurance through an employer, they understood all of this. They shopped and they got the plans, and then open enrollment came around, and you picked from the options that they selected. Now you're your own business owner when you turn 65 and enroll in Medicare. So you get to understand and decide how you want to pay for your hospital and your doctor. So think of it like that. It's not confusing. You just now are your own business owner because you're in retirement and you have to handle your own insurance. All right, so that's a summary of that. Remember, we've got part A. We've created our SSA.gov account, so we know that we're getting that premium free because we've worked our 40 quarters. If you, for some reason, have not, contact me and we can talk through that. Part B, a reminder, that's our doctors. There is a premium for that. We'll go over it. Part C is combo. We'll go into more detail. And part D is prescription. Okay. So let's take a pause, let that sink in. And here's another question I want you to think about as a grandparent. Are you helping to care for grandchildren or family members? This is important because if you are like myself, if your children are 40 or so or things like that, most of the time you are probably, as a 65-year-old, you are probably caring for your parents if they are still with us. So if you care for your parents and you care for your grandchildren, your child will be considered the sandwich generation because they are taking care of their kids, they're taking care of themselves, they're helping you. You know, the generations are helping each other. So we want to keep that in mind because we need to know if we need a healthcare plan that provides maybe televisits. If you have to pick up your grandchildren at a certain time every day, or if you are the person who's on call when folks get sick, you probably need a flexible schedule, or you might need lower copays because your retirement funds go to support others. So keep this in mind. Think about how you help care for others and also think about what would happen if you needed your own care. Because I'll tell you, I'll say this several times during this presentation that understanding Medicare, all of the different letters, don't let that overwhelm you. The most important thing to understand is what Medicare does not cover. That is what you want to be crystal clear on, is what Medicare doesn't cover. So let's get back into understanding the different types of Medicare. And we're going to start with traditional Medicare right here. So that is parts A and B. Remember, it's going to be handled different for each person. So traditional Medicare is part A and B, back to our house, the hospital, and the part B is our doctors, and something to start getting you to think about because next we'll talk about those Advantage plans, part C. But with Part A and B, original Medicare, that covers the hospital, that covers your doctor's visits and all of that. It does not cover everything like vision, dental, hearing, and long term care. Now, this does not mean if something happens to your actual eye that the health insurance won't take care of it. It will because that's connected to your body. But glasses and things like that, implants, additional kind of like the extras, I call those the accessories, that's not covered by Medicare. So that's one of the gaps that we'll be looking to fill as we decide how we want to handle your health plan. Another thing to keep in mind is Medicare covers 80% of the cost. You are responsible for 20% of the cost. I hear so many times, especially if we have healthy individuals who enroll in Medicare and now they've been on Medicare, let's say they're like 75, 80, and they start to have health issues, diabetes is on the rise. All of a sudden, you hear folks saying, I thought Medicare would cover this. They didn't cover this. And here's an important slide to remember that covering something does not mean free. Medicare may cover it, and that means they cover 80% of it. 20% of it is still going to be your responsibility. So these are gaps that we'll be looking to fill. And now you'll start to see why it's not necessarily that you don't need to get caught up on trying to remember what we call the alphabet soup. You want to make sure that you understand what Medicare is going to cover and what they're not going to cover. And then we're going to part C that we talked about the combo before, but another option that we'll also talk about is a meta gap. And it is exactly what it sounds like. It is a gap filler. So that is something that you can pay for in addition that will cover that 20% coinsurance. So that was a lot of information, but it's going to continue to get clearer because it's just a lot of information. So the more you hear about it, the easier it will be. So next, let's go into the Medicare Advantage plan. It's Part C, what you'll hear about. I like to call that a combo because it is just that. It's an all-in-one plan for a private insurance company. So that's going to cover your Part A. Remember the first part of our house, which is your hospital. It's going to include your Part B, which is your doctors and your specialists, and that will have a copay. They also usually include Part D, which you'll hear get comfortable with the word formulary. That's going to be your prescription drugs. So, with that Medicare Advantage Part C, you'll see that's all in one. It's going to cover all of your traditional Medicare and add in your prescription drug coverage. What I like to compare Medicare Advantage to most frequently is your employer coverage. With your employer coverage, you're going to have a health deductible, you're going to have a max out of pocket, you'll have copays, you'll have prescription coverage and fees like that. This is what this is. You also, do you ever do walk those walk benefits and things at work, or your different carriers will have, and they'll give you additional money or gift cards or things like that? Medicare Advantage plans are going to have that. They're going to have extra benefits. They're going to have glasses, dental, hearing, gym memberships. It also will be a HMO and PPO, different costs, different coverage rules. This HMO and PPO does not mean the same in Medicare land as it does when you're employed. I will go into that, something else that we would talk about one on one. But right here, one thing I also want you to remember if you go this route is Medicare Advantage Part C definitely also stands for change. This is something that's going to change every year. I strongly, strongly encourage you not to select your plan based on the extras because they can be removed at any time. But I'll tell you what, if you're turning 65 now, if your parents are still with us, they are older and been on Medicare for a long time, and all they care about are the extra benefits because that's what's important right now. So, as you learn about enrolling yourself, getting yourself set up for Medicare, this is a perfect time to think about those that you care about that are older than you. So, right now, just remember that Medicare Advantage Part C, that is a combo that's going to wrap everything up together. So that's something to really think about. Is that important to you? Do you want a coverage that automatically comes with a fitness membership and preventative programs and all of those extras? Do you want your insurance to feel exactly like it was at work, changing all the time? You're not really necessarily in control, but you have a lot of different options to pick. So that's another question that you'll want to jot down that we'll talk through. Okay, so prescription drug coverage, again, this comes up because it has to be or it could be handled differently for each individual. If you're a vet, you might get your prescriptions through the VA, so you don't really care about a plan that has drug coverage. If you decide to go the Medicare Advantage route, your prescriptions are covered in there. So that takes care of Part D. If you decide to do what we talked about briefly, we'll go into more detail here soon. A Medigap plan, that's going to be a separate coverage that you need to build into and add in your separate dental and kind of create a plan. So prescription D coverage is handled based on how you decide to handle A and B. That seems like a lot here, but again, it's just a lot of information. Not really confusing, it's just a lot of information. Remember, we're changing our mindset for 2026. So, This can be handled different ways. That is the perfect way to not be confused by how prescription and Part D or what that is to think about how you handle your prescriptions now. First, an important thing is going to be, do you have a lot of prescriptions? Are they expensive? That's going to take us back to deciding how we select between an Advantage plan or a supplement. And we'll get into next about what a supplement means. So we know the Advantage plan, what I want you to remember about that, because now we're getting into the options of how we are enrolling in Medicare. So all of that before, all of that A, B alphabet soup, that is explaining the history and the foundation of how you're building your healthcare plan. Now we're deciding how we're going to cover our 20%. Are we going to go the combo route and keep it like an employer, or are we going to do something like a supplement, a Medicare plan? I put Charles here, he's 72, because I want to remind you that there are different enrollment times. Everyone does not start Medicare at 65. Some folks keep working and wait until retirement. There's a thing called credible coverage that we would get into and talk about you getting enrolled. But the important thing to do is contact your insurance broker. Even if you are young, tell your kids now if they have insurance through their employer, it's still okay to get an outside opinion to go over those enrollments. I do it with my friends all the time. So let's get back to understanding the Medigap. These are 2025 numbers. 2026 numbers are out, but I still got 3 solid months in 2025. So let's just imagine that we're in this year. So Charles here, he decided to choose Medigap because he travels a lot between Texas and Florida, and he wants his coverage wherever he is. Now, this is not to say if you go out of town and you have an emergency, they're not going to leave you on the side of the road. They will, you are able to go to the hospital in emergency situations, but you're not able to have routine care with a traditional HMO plan. Um, out of the state. So with a supplement, you can do that. So you think about how you want to retire. Do you have several kids that live in different places and grandkids? Are you traveling around a lot in retirement, or is that your plan? You're going to want something that has flexibility. Also, something to keep in mind normally when you start to get ready for retirement, your income. Your income changes. Sometimes it decreases. So, Charles here did not want to worry about the co insurance. He doesn't want to pay doctor's visits. He doesn't want to get all those random bills. So, how that works, so this is going to illustrate the 80/20, how Medicare pays and then you pay the 20%. So Medicare Part A deductible, it doesn't have a premium. Remember, this is different. The deductible for 2025 is $1,676. That's if you go into the hospital, if you want a handout, I have one I can send to you. Let me know. But if you decided to buy, and we're talking about a Plan G supplement, there's different letters, of course, alphabet soup, I tell you. But Plan G is the one we talk about most often because that completely fills pretty much that 20%. So if you go to the hospital because you have a Medigap plan, you are not going to be paying or expecting a bill for that $1,676 because your plan G paid it. As you continue, if you continue to be in the hospital, those additional coinsurance that you would normally pay, that's covered by Plan G because you pay a monthly premium. All of the doctor's visits and all of that, you're not paying copays and things like that because it's covered by Plan G. There's definitely a monthly premium. It's different between male and female tobacco use and zip code. About $120 to $180. And just like everything else in the world, this goes up. This goes up every year. Also, I don't think I mentioned it earlier, but when we talked about Part A being free if we worked, Part B for 2025 is $185 a month. That's going to automatically come out of your Social Security. Yes, if you keep working and you want to be on Medicare, you don't have to draw your Social Security and you can still pay your Part B. We would talk about that, but Part B has a premium of 2025, $185. In 2026, it will be $206.50. So look at that right now. If we decide to fill in our gap with the Plan G, that 20%, we're going to be paying our Part B $206.50, and then whatever our premium is for our Plan G. So just for rough math, that's going to run us about $400 a month. If you're married, that's per person. Also, the only other thing you will expect if you go to the hospital is you do have a Part B health deductible for 2025. It's $257. 2026, I believe it's $288. Remember, everything goes up every year. So you would pay your $400 a month covering your Part B and your Medigap premium. And then the only thing you would ever expect to pay is $257 for the year. See how that works? It's consistent. Even though it goes up every year, you are not getting extra bills. With the Medicare Advantage, it's just like your employer's bill. It probably does not cost you anything. A lot of the Advantage plans have zero premiums. However, when you need to use them, you have to pay out of pocket for doctor's visits, for hospitals, for surgeries, labs, MRIs, all of that. All right. So that brings me to just to summarize now that we've gone so far is what's important to you when you're looking at your income for retirement. Do you want low out of pocket costs? Do you want flexibility? Have you set aside a budget for extra health care? How much were you planning to pay? How much do you pay now? So, these are all questions we think about and answer as we make this decision for our business, which is our life. So, now the most important part that I talked about, we want to be clear on what Medicare does not cover. So if you are with me or if you are not familiar, I am talking about, I would want you to look at a sheet that goes over our ADLs. And if you don't know what ADLs are, I bet you as soon as I tell you what they are, you're going to remember them. So ADLs are your activities of daily living. This is your bathing, dressing, toileting, eating, going to the bathroom, getting out of the bed, all of that. Think about using the telephone, shopping, transportation. But your main six standard ADLs are bathing, dressing, going to the bathroom, eating, and getting in and out of bed or a chair. So, Medicare does not cover long term care. Yes, if you hurt yourself or fall, they're going to get you back together, but they're not going to come and help bathe you, dress you, feed you, and things like that. It's not covered. That long term care, custodial care, just also think about your nursing home and things like that. So, this is something you want to plan for because as we age, things start to happen. So, long term care is not something that's covered in traditional Medicare. Remember, don't get confused when we're thinking about Part C because that's not traditional. Traditional Medicare is our Part A and B, and that is dental, vision, and hearing is not covered. So if you don't go the Advantage plan route and you go the supplement route, we'll have to make a plan and buy products that will help fill in the gaps for dental, vision, and hearing. Also, just a reminder, cosmetic surgery is not covered, routine foot care is not covered. If you go into an Advantage plan, you will see foot care in there. Those are for our diabetic people who need a podiatrist to do their pedicures and things like that. And then overseas medical care, we kind of talked about that. Emergencies are handled, but just wanting to do routine care over there, traditionally, that is not covered. So this is the gaps, additional gaps that we want to make sure we cover. So we know we have the 20%, and then we have to think of our regular ADLs. The doctor, think about it right now. Before you're 65, when you have a surgery or you hurt yourself, the doctor stitches you back together, gets you healed, but he does not go home and make sure that you're eating and getting dressed and going to the bathroom and all of those things. Even when you go to a skilled nursing or a facility, they get you rehabbed enough to get out of the hospital and get home. That additional healing and curing is on you. Okay, we're getting close. So let's go over the enrollment periods. We'll do this. And then I just want to give you a sneak peek in what changes happen for 2026. So you will know, like, after your first time enrolling in Medicare, you'll kind of be able to anticipate what will happen next. So, enrollment periods. Initial enrollment was around your 65th birthday, 7 months. That's 3 months before, 3 months after. This can be adjusted if you have what's called credible coverage. We can go into more detail with that one on one through your employer normally. So it's very important to keep up with the initial enrollment period and make sure that you have your insurance set up properly if you're not enrolling, because there are lifelong penalties that exist. So you want to make sure this is a very important screen. You want to make sure that you enrolled at the right time. Um, there's additional information that we'll talk about around the cost when we have your one-on-one, but also general enrollment periods. This is after the end of the year, when things happen. If you like miss the next one, um, is January 1st to March 31st. I kind of stumbled through that because I'm not sure why I put that second. It should have been third. But traditional open enrollment, which starts soon here, is October 15th to December 7th. That is when you can switch Advantage plans and shop drug plans. Just a special note here, supplement plans, you normally keep those. Each year you don't change those because they have some underwriting. Special en- enrollment periods are with special life events. So think about if you moved, if you get married or divorced or something like that happens. But a lot of things can count as life events. So I always say, when in doubt, call me, call your agent. Okay. So there, another thing that people think about here, we'll talk about, is full retirement age and income. Full retirement, just to understand, because that's an important one when you enrolling. If you were born in 1960 or later, full retirement is the age 67. If you were born in 1959, 66 and 10 months is full retirement, and 70 is like the max amount of time. And why that is important is because a couple of things: if you start to draw your social security, if you go over a certain amount, for they withhold $1 for every $2. But that, we're not going to go down that rabbit hole right now. We'll talk about that one-on-one, because it makes you frustrated when you hear that they're going to hold $1 for every $2 over a certain amount you make. But there's two different workarounds, or two different ways to look at that. One, if you want to keep working, you can keep working and delay, and then you won't get the penalties. Two, even though they hold that dollar, later after you reach full retirement, they recalculate and you get that money back. So it just has a really bad stigma. So that pretty much wraps up like Medicare one-on-one. Now I want to go quickly through the changes that we are seeing, going into 2026. So you can see, like, after that initial one, how this works as you being a business owner every year and updating your plan. So that Part B premium that I breezed through and didn't really give you a lot of detail on, for 2025, it was $185. For 2026, it'll be $206.50. That's a difference of $21.50. Back when Medicare started in 1965, it was $3. So look how much it changed. That's something that when we're picking our plans, you want to think about, because it does go up every year. That health deductible that we talked about, that's increasing $31 this year. Last year it was 200. I mean, this year it's 257. Next year it'll be 288. So that is definitely something to keep in mind. We'll always kind of forecast, decades ahead, to make sure that we are picking plans that align with our future budget. Part D, I'll just tell you that prescriptions change a lot. And how I normally summarize this is, Medicare is all about being preventative. And when you're not, it's going to cost. So we continue to see year after year up and down coverage when it comes to drugs. Um, the Part D deductibles are going up. The max out of pocket is increasing by $100. There's going to be less drugs available. They're changing. So a lot, just always anticipate, especially if you are someone who takes a lot of medication. It's going to be more expensive to navigate that as the years go on. So we really want to push to be as healthy as possible. Advantage plan, remember, like I said, it's very much like your employers. Every year you will see a lot of different changes when it comes to Medicare Advantage. There'll be different plans available. Some of the benefits you loved might go away, some carriers might change. Here in Texas, I made this one block by itself because it was a big deal when Baylor stopped taking Humana. Here, this, check your ANOC letter. That's your annual notice of change letter. People never read it, but they do tell you every year what's going to change. And then the last thing, kind of how supplements change. Remember, this is something that we will not shop every year, but the rates would increase because when you first turn 65 or you first enroll in Medicare, you are guaranteed issue. But if you want to change or have that later, it is some underwriting. There's always changes with prior authorizations, and still they see the impact of changes with drug plans. But there's a lot of changes. It's a lot of information, but it doesn't have to be confusing when you work with a broker. And finally, again, I am Paris, working to be your favorite Paris. Here's our information. We're located right here in Bedford, Texas. Now, we are licensed in many states, so we're happy to help you or get you someone who can. But if you didn't take anything else from this today, just make sure that you talk about and plan for your future with someone you trust and someone that's licensed like me. Thank you so much for letting me dream with you and dreaming with me. Bye bye.